Alright guys, we're going to look at the family's role in healthcare. So family structure and function has a very important influence on the health of our patient, especially our pediatric patients. If you think about it, those pediatric patients are completely dependent upon their family members, whether that be mom, dad, aunt, uncle, grandma, grandpa, whoever that may be. They have a huge influence on their health. So a child's physical and emotional health and cognitive social functioning is strongly influenced by how well the family functions. So there are lots of theories that have been developed to kind of describe how families operate and how they respond to events both internal and external, especially those health events. But one theory that we're going to look at is the family health system approach, and it looks at 5 different processes: the interactive process, developmental process, coping process, integrity, and health process. So to better understand this, I think it's important to look at a case study, and we'll think through this case study as we dive into each of those processes for the family health system approach. So we're going to read about Ian Chappell. Ian was a low birth weight infant, and he has short bowel syndrome. This syndrome is characterized by maldigestion, malabsorption, dehydration, electrolyte abnormalities, and both macronutrient and micronutrient deficiencies. Owing to new medical and surgical treatments, the survival rate is 73 to 89%. So that's a fairly good survival rate. Ian, however, will require long-term parenteral nutrition. So what that means is that he will be receiving all of his nutrition through intravenous solutions. So he will no longer be able to take food orally. Ian is the first child of Dylan and Adriana Chappell, both in their early 30s. After a stay in the NICU, Ian was sent home with his parents, who have provided care for him since then with the help of a home care agency and a nutritional support company. The Chappells do not have any other family members nearby. The majority of Ian's care falls on them. Ian is now 2 years old and very active. Miss Chappell is the primary caregiver during the day and most evenings. She works weekends as a nursing assistant, and she does that to help supplement their family income. Mr. Chappell works as a paralegal in a law firm and attends law school at night. So the Chappell's insurance coverage is through the group plan that is given through the law firm where Mr. Chappell works. Alright, so as we move through these processes, I want us to think back to little Ian and his mom and dad and how this interacts. So speaking of interacting, the interactive process is the first process in the family health systems approach theory. So the interactive process of the family is composed of communication, family relationships, and social supports. So of course we want to encourage open communication in any family, but here we're going to be assessing how the interactive process works in the Chappell family. What kinds of things are we going to ask them? What's their communication pattern? How well do they communicate? Do you think there's anything affecting their communication? It sounds like Adriana and Dylan might not see each other very often because they're both so busy with their different jobs and everything like that. What's their relationship like in the family? What kind of social supports do they have, right? It sounds like Adriana doesn't have a lot of support, or Dylan. They don't have a lot of social supports. They don't have any family nearby, extended family, to help them out. Those are some of the things that you'll explore. So you may want to offer support groups, may be really helpful for this family, or even something that's called respite care. And this allows caregivers to get a little bit of a breather so that they can recover both mentally, emotionally, and physically. So the next step in the family health systems approach is the developmental process. So here you're assessing the developmental process of both the family and the individual. So let's think about Ian first. Remember, Ian is now 2. So what happens at 2? You're becoming more active, you're exploring your environment more, right? You're having to think through those developmental stages. And he's going to want to run around, right? He's a 2-year-old. And if he's tied to an IV pole, that might be difficult. So kind of thinking through those different developmental processes for him. What about the Chappell family? How do we look at the developmental level of a family? So Duval, back in 1977, developed what's called the family life cycle, and it has 8 stages of the family life cycle, but here are some. And what phase do you think the Chappell family is in? They're in the childbearing family years. Their oldest child is from between birth to 30 months. So it's important to note what level this family is in, because we need to be able to meet them where they are, right? They don't have older children to know what's normal and abnormal for a normal, healthy child, right? So they don't have really anything to base it off of, base this parenting off of Ian, who's a little bit different, right? So understanding the development of the family along with the individual is important. The next process we're looking at is the coping process. So coping is identified as problem solving, adaptation to stress and crises, and the management of resources. Coping helps us lower our anxiety so that we can meet the needs of each and every day. Each and every person has different coping styles when dealing with uncertainty. So we all deal with stress, and we all cope a little bit differently. Coping styles can be both problem-focused or emotion-focused. So we can be coping and trying to deal with the problem at hand, or coping with the emotions that may be caused from the problem. The uncertainty of the illness presents a variety of stressors for different families. So it may be the financial piece to the illness that's causing stress. It may be the health status or the loss of independence that's causing stress. So what would you assess to measure the Chappell's coping process? How are they doing day to day? Are they fighting? Is there miscommunication? Are they frustrated? Do they feel guilty? And kind of filling out their feelings, seeing how their day to day looks, how they're functioning. Are they depressed? Are they anxious? What are the overall feelings from the family? And normalizing some of those feelings, telling them that it's okay to be frustrated with this illness. That's okay. Telling them that it's not their fault. They don't need to feel guilty. There was nothing that they did wrong. Because a lot of times with illness, people feel guilty, especially with children. They feel guilty, like there was something that they could have done to make it go away, or for it not to have happened. So that's the coping process. Integrity process. The integrity process of family life involves the family's values, rituals, history, and their identity. So each family has their own beliefs, their own values, things that are important to them, how they see themselves. And it's important to understand each and every family's different integrity processes. So they may have different rituals around celebrations or traditions, different birthdays, holidays, even bedtime routines can kind of become like a ritual. My kiddos, we have a very set kind of ritual we go through every night. And if we veer away from that, it's a little bit of an upheaval for them. Role changes can also occur due to different illnesses, and this kind of upheaves the family a little bit in these different role changes. So what are some ways we could assess the Chappell's integrity process, including their rituals and their roles? So looking at what's important to the family, what are some of the rituals that were important to them before Ian was sick, before he was born? Was it important for them to sit down and have a family meal? Has that changed because Ian can't eat orally? What are their roles? Did Mrs. Chappell see herself being the full-time caregiver before they had Ian and before he was diagnosed with short bowel syndrome? Did they expect to put him in daycare and for her to work full-time? Some of those expectations and then the realities being very different causes some discomfort and some changes for the family. So it's important to realize that in this integrity process. And then the health process. This is including the family's health status, their health beliefs and practices, and lifestyle practices. So some families, they wait until the very last minute, until they're very, very sick, to reach out for help. And others, you have a few sneezes and you're going to go see the doctor, right? These are just differences in family lifestyles, different health beliefs, just like those that choose not to vaccinate and those that choose to vaccinate. There are just different health beliefs, and a lot of these are based on different families. families. So how do we explore what the chapel's health process is? How do they feel about their own health? What are their expectations for Ian's health status? Do they expect him to be cured? Is that even reasonable, right? So things like that help us to assess their health process and to understand this family dynamic. Because remember, this family is going to be what influences the child's health and well-being. And of course, that's what we're looking at with our pediatric patients, because it is so important, those influences from our families.